A senior Fermanagh surgeon has told UTV he fears emergency general surgery at the South West Acute Hospital in Enniskillen will be removed for good. He's warned if that happens, lives will be at risk.
It comes as the Western Trust says the temporary suspension of services will continue as they still do not have the staff. Hundreds of patients have been transferred to other hospitals since December, but the Trust says no patient was put in danger. Sarah O'Kane reports.
There's been no emergency general surgery at this hospital since December. The Western Trust suspended the service at the South West Acute temporarily because they say they don't have the staff. And in an update to the Trust's board today, nothing has changed. Dr. Isam Garib was a senior surgeon at the hospital for 30 years.
There is no patients who are asked in the whole UK in an urgent or emergency case to travel for about 2 or 3 hours. This is going to be very dangerous.
Do you firmly believe lives are at risk?
I do.
And you yourself have saved many lives throughout your career. If you hadn't have been where you were and your patients had to be transferred, would they have survived?
Oh no, in some cases there is no doubt about it, they wouldn't survive.
Figures from the Western Trust show over the last 5 months, 321 patients at the South West Acute needed emergency general surgery. 296 of those were transferred to Altnagelvin, 25 were taken to Craigavon. That's an average of 2 patients a day. The Trust has also spent £150,000 on private ambulances to transfer those needing general emergency surgery. Do you think that's money well spent?
Well, the important part of this is about patient experience, patient journey. We also know that Northern Ireland Ambulance Service has some challenges and we do not want to put any undue pressure in that particular area. And we see that as a viable alternative to making sure that any patient who requires transfer does have access to that in a very timely way. And we know that since the pathways have been in place, there's been no adverse outcomes for patients as a result of that.
The temporary removal of emergency general surgery has been controversial. A public consultation on the matter ended in April. But the Trust says, despite some suggestions from the public to help retain the service, no alternatives have emerged. Has a decision been made and you're just not telling us?
The people will understand and know that we reached a crisis point in October, November last year when we had a number of resignations from within the organisation, and we needed to act quickly at that point to make sure that we mitigated any risk for our population that we serve.
SWA is now one of 3 planned overnight surgical hubs in Northern Ireland. Since January, 600 patients have been operated on. It was a move by the Department of Health to cut waiting times. Some claim, though, without emergency general surgery at the site, acute services will disappear.
It's just going to be like a large, expensive nursing home. That's going to be. Down the line, you will see it may come to a judicial review.
The board is expected to meet again in October.
Well, we can now join Sarah live at the South West Acute Hospital in Enniskillen for us this evening. Sarah, where does all of this lie now then?
Well, the answer to that is we're simply no further forward. It's been 5 months and the Trust say they don't have the staff and this temporary move is set to continue. Now, I did ask them, do they have a time frame potentially for when a final decision will have to be made? And they said, Sarah, look, this still very much is a temporary scenario. Now, they have managed to recruit 2 consultants and they will be able to carry out emergency general surgery. But the reality of that is a trust-wide based recruitment drive because simply no one applied to be based here in Fermanagh. Interviews are set to continue, but as you can imagine, there are obviously those community concerns that these services are set to go for good. Now, the Trust say, look, this is working well and patients that have been transferred, their safety is paramount.
Sarah, thank you very much. And for more on this story and indeed for more on all of today's stories, head to our website and just search UTV News.